Welcome to UMCC Medical Consultants Connectors, where your health matters to us. A fracture is a medical term for a broken bone. It occurs when the physical force exerted on the bone is stronger than the bone itself. This can happen due to various reasons, such as falls, accidents, or direct blows to the body. Fractures are common injuries affecting millions of people each year. They are one of the most frequent reasons for emergency room visits and can range from minor to severe. They can happen to anyone, regardless of age, but some people are more at risk than others. For instance, children and athletes are prone to fractures due to high levels of physical activity, while the elderly are at risk due to bone density loss. Bones are strong and designed to withstand a certain amount of force. They provide structure and support to our bodies, allowing us to move and perform daily activities. However, if the force applied to a bone exceeds its strength, it can break. This can result in different types of fractures depending on the nature and direction of the force. Fractures can range in severity from a hairline crack to a complete break that shatters the bone into multiple pieces. Each type of fracture requires a specific approach to treatment and healing. Understanding the causes, symptoms, and treatment of fractures is crucial for ensuring proper care and a speedy recovery. Early diagnosis and appropriate medical intervention can significantly improve outcomes. By being aware of the risks and taking preventive measures, we can minimize the occurrence of these injuries and maintain the health of our bones. Regular exercise, a balanced diet rich in calcium and vitamin D, and using protective gear during activities can all contribute to stronger, healthier bones. Fractures are typically caused by a sudden impact or force that is too great for the bone to withstand. Falls are a leading cause of fractures, especially among older adults and young children. High-impact sports and activities like skiing, football, and skateboarding can also put individuals at increased risk of fractures. Car accidents, bicycle accidents, and other traumatic events can generate significant force, leading to broken bones. In some cases, fractures can occur due to underlying medical conditions that weaken the bones. Osteoporosis, for example, is a condition that causes bones to become thin and brittle, making them more susceptible to fractures. Recognizing the signs and symptoms of a fracture is essential for seeking prompt medical attention. The most common symptom of a fracture is pain. The pain is usually severe and may worsen with movement or pressure on the affected area. Swelling, bruising, and tenderness around the injured area are also common signs of a fracture. You may also experience difficulty moving or using the injured limb or joint. In some cases, you may hear or feel a snapping or grinding sensation at the time of the injury. If you suspect a fracture, it's important to seek medical attention immediately. Section 4. Diagnosis and treatment of fractures. To diagnose a fracture, doctors typically begin with a physical examination of the injured area. They will carefully check for any signs of swelling, bruising, or deformity. This initial assessment helps them understand the extent of the injury and determine the next steps. They will ask about your medical history and how the injury occurred. This information is crucial as it provides context and helps in identifying any underlying conditions that might affect the treatment plan. X-rays are the most common imaging test used to diagnose fractures. These images allow doctors to see the exact location and severity of the break, which is essential for planning the appropriate treatment. X-rays use low doses of radiation to create images of the bones. The radiologist will analyze these images to confirm the diagnosis and provide detailed information about the fracture. Treatment for a fracture depends on the severity and location of the break. The doctor will discuss various treatment options with you, considering factors such as your age, overall health, and activity level. For minor fractures, treatment may involve immobilizing the injured limb with a cast or splint to allow the bone to heal. This method is effective for simple fractures where the bone ends are well aligned. More severe fractures may require surgery to realign the broken bones and stabilize them with metal plates, screws, or rods. This surgical intervention ensures that the bones heal correctly and restores function to the injured area. Section 5. Preventing fractures, keeping your bones strong. While not all fractures are preventable, there are steps you can take to reduce your risk. One of the most important things you can do is to ensure that your diet is rich in essential nutrients. Calcium and vitamin D are particularly important for bone health. Calcium helps to build and maintain strong bones, while vitamin D improves your body's ability to absorb calcium. Maintaining strong bones through a balanced diet rich in calcium and vitamin D is crucial. Weight-bearing exercises like walking, running, and jogging are excellent for building bone density. These activities put stress on your bones, which helps to stimulate bone growth and strength. Dancing is another fun and effective way to strengthen your bones. Whether it's a structured dance class or just dancing around your living room, the movement and weight-bearing nature of dance can significantly contribute to bone health. Wearing appropriate protective gear during sports and activities can help to cushion falls and prevent injuries. Helmets, knee pads, and wrist guards are essential, especially for high-impact sports. This is particularly important for children and athletes who are more prone to falls and collisions. Ensuring adequate lighting in your home and removing tripping hazards can reduce the risk of falls, especially for older adults. Simple changes like installing night lights, securing loose rugs, and keeping pathways clear can make a big difference in preventing accidents. By taking these preventive measures, you can significantly reduce your risk of experiencing a fracture and keep your bones healthy and strong for years to come. Regular checkups with your healthcare provider can also help to monitor your bone health and catch any potential issues early. Remember, prevention is always better than cure. Taking proactive steps today can lead to a healthier, more active future. UMCC, your ultimate medical consultants connectors.